Thank you for joining us for our Medicare 101, your questions answered. We thought this would be a good timely webinar presentation subject, considering that open enrollment is quickly approaching. My name is Gigi Lakites. I'm a financial advisor and partner with PKS Investment Advisors, and I'm joined by Alyssa Sinagra from Avery Hall Insurance. Thank you so much, Alyssa, for joining us. A little bit about PKS Investment Advisors. We were established in 1999. We are a fiduciary and independent registered investment advisor associated with PKS and Company, the accounting firm, with office locations in Salisbury, Lewis, Delaware, and West Ocean City. We are a fiduciary, as I stated, putting our clients' interest ahead of our own with regards to all of our financial planning and investments. And we offer all things financial, is what we'd like to say at PKS, under one roof, with the tax planning and the financial planning together. So we're going to go ahead and get started, and I'd like to introduce Alyssa Sinagra from Avery Hall Insurance. If you'd like to go ahead and introduce yourself.
Yeah. Yes, hi, my name is Alyssa Sinagra with Avery Hall Benefit Solutions. Just as Gigi says, they try to keep everything under their roof with like financial planning and CPA firm. We do the same with insurance. I'm specifically on the benefit side, so we handle the individual insurances, like ACA type of insurance, Medicare insurances, and then we also have a division that does employee benefits that sells insurances to employers. I've been with Avery Hall since 2006. We are licensed in a lot of different states, so if you're moving or if you have friends or family members in different states, we can usually assist them as well. And then our goal typically is to help educate people. We don't like to consider ourselves salespeople. We want to educate and help be there as a resource to our community to help make sure people are understanding what they have and what they can get and what's available to them.
Wonderful. So let's go ahead and get started with, I'm going to pose the questions to Alyssa, and she's going to give her expert advice and information. What is Medicare, and what are all the four parts of Medicare?
Great. Yep. So Medicare is a federally sponsored program, and I put the word federal in there because it's a lot different than the type of insurance you have today. Federal means that it's across the United States, and that's a really good thing because of your network. A lot of people are confined to a network. You would be confined to a network with Medicare as well, but the Medicare network is across the United States. They provide medical services that are medically necessary procedures and services, such as your doctor's visits, your hospitalization, your labs, your x-rays, infusions, anything that's medically necessary typically is covered. The coverage, just like your coverage if you were with an employer or on an ACA plan, also requires co-payments and deductibles and co-insurance that typically you're responsible for, or your Medicare supplement or secondary insurance is responsible for. There are four parts of Medicare, and they've used the alphabet to help, confuse us a little bit more. But Medicare Part A, B, C, and D are the four parts of Medicare. Medicare Part A is your hospital insurance. Medicare Part B is medical insurance. I like to think of A as services for inpatient services, and then Part B is for outpatient services. Part C would replace your Medicare A and B, and it would be in and out of patient services as well. It's called Medicare Advantage plans. And then finally, Part D, which is your prescription drug coverage. Part A, again, is for inpatient hospitalization and any kind of home health care, hospice, or blood, and even covers skilled nursing care in a facility, which is inpatient rehabilitation. I try to define that for people because it's not nursing home care, it's inpatient rehabilitation. So as long as you're getting better, it would be covered under Medicare Part A. Medicare Part B is the outpatient services. So this is going to help cover all your physician services, your outpatient surgery, your labs, your x-rays, even like intermittent home health care, not like inpatient home health care. Medicare Part B has an annual deductible. That deductible for 2023 is $226. However, that is subject to change each year. And that deductible does change every January 1st. I'm usually the last to know. So usually my beneficiaries get letters before they publish it to the agent. So hopefully we'll learn about what the new deductible is for next year in the next coming month or so. Medicare Part C, as I mentioned earlier, it replaces Medicare A and B. You do still have to pay for your Medicare premium. out of your Social Security benefit check, which we'll get into a little bit later. However, Medicare Part C is a network-based, so you're going to go back into like a smaller network, where Medicare is a much larger network. There's different plans available all over the country, but they are all also county specific. So they're, you know, right here in this area, not all over kind of thing. And then Medicare Part D. So that's the open enrollment that we're getting ready to come about. It's for prescription drug plans. Anyone covered by Medicare A or B is eligible to join one of these plans. They are sold by private insurance companies. And each plan, let's say there's 25 in Maryland, or 26, I'm not quite sure right now. I think it's 25 or 26, but there's each plan has a different list of medications that they cover. And so it's important to find the right plan for your prescriptions because of the different lists that each company has. The other thing that is different about each company is that they have a different list of preferred pharmacies. And so your unique list and your pharmacy may be different from your friends or your husband's or your spouse. And, you know, so you may have two different plans because of your unique list and your pharmacy.
Oh, wow. That's great. So who needs to enroll in Medicare?
Yep. So who needs to enroll into Medicare? Anyone who is age 65 or older can enroll into Medicare. Some people decide to stay on their employer insurance or their spouse's employer insurance, which is fine. But if you are over the age of 65 and you want to enroll in Medicare and not stay on your spouse's insurance or your employer insurance, that's when you would want to sign up for Medicare.
And how do you enroll, I guess, is the next question.
Yep. How do you enroll? So there's two different ways to enroll into Medicare. The first way is if you're collecting Social Security benefits prior to age 65, you're going to be automatically enrolled into Medicare. And if you're not collecting Social Security benefits, then you have to do it manually. And so the other people that have to do it manually is the people who decide to continue to work and to stay on their employer insurance or their spouse's employer insurance. When you do decide to retire and to take Medicare, you do have to sign up for Medicare manually as well, which is a paper today. So.
Well, and that's another leads me to the other question, and I should ask this previously, is if you are still working and 65, do you still need to enroll in Medicare?
Yes. So you don't have to enroll into Medicare if you are still working and you are age 65, as long as your coverage is credible, and most employer-sponsored coverage is credible. But typically when that question gets posed to us, we refer people back to their HR just to confirm that their coverage is deemed credible, but most employer insurance is.
Okay. What is the special enrollment period?
Yeah, so there's several different enrollment periods. We have like the initial enrollment period, annual enrollment period, general enrollment period, and special enrollment period. The special enrollment period is for people who are losing employer-sponsored coverage, and it guarantees them their coverage to start the first of the following month after they've enrolled. And it would be based on special circumstances like loss of employer coverage. And so that would be the enrollment period someone would use when they decide to apply for Medicare after age 65.
Okay, thank you.
Mm-hmm.
What happens if you, I'm sorry, you're going into the special enrollment. I'm sorry.
Yeah, sorry. Went ahead. Just again, the loss of employer coverage, or if you've moved to a new address, or loss of Medicaid is special enrollment periods.
Okay.
Those are the most common ones.
What happens if you don't enroll in Medicare?
Yep. So we've mentioned that you can enroll into Medicare at age 65, or you can choose to stay on your employer coverage. And so a lot of scare tactics out there right now, and advertisements and other avenues, is that if you don't enroll into Medicare, there is a penalty that you would face. But if you use that special enrollment penalty or that special enrollment period, then you won't have a penalty because you have credible coverage through your employer. But I have had situations where people just don't enroll into Medicare, or they decide to stay on their like marketplace or ACA coverage, and you will face a penalty if you do that. So it is very important that you enroll in Medicare when you're supposed to. And if you're not sure when you're supposed to, that would be the advice that you would want to seek, is like, am I supposed to do this? This is the type of coverage I have. But the penalty can be quite hefty. It's 1% for every month that you don't join Medicare A and B. And then, I'm sorry, lost my train of thought. But you'll pay an extra 10% for each year after that. So the penalty doesn't go away. That's what I wanted to say, is it stays with you for the rest of your life. And then in addition to that, you would be using the general enrollment period, which would be a July 1st effective date. So you may realize in November, oh, I don't have any coverage. And then unfortunately, you wouldn't be able to get coverage until July 1st of the following year. So you would be without coverage.
Important to pay attention to those details then.
Absolutely. Yeah.
So can my income or someone's income affect the Medicare premium?
Yes. Yes.
Yeah.
So Medicare premium is based on your income, actually. If your income is under a certain amount, then you would just pay the standard premium, which is $164.90. You'll see in the fourth column over that that's the standard monthly premium. And then on the left-hand side is your income. So whether you're single, joint, or you're married filing separately, there are different columns there or different rows where your income is. And they always look at 2 years prior. So for 2023, they're looking at your 2021 income. And then in 2024, they'll look at your 2022 income. Now, I've had a lot of situations where people retire, and so they no longer have the income that they had 2 years prior. And so there is an appeal form that you can use to appeal this decision, which would remove the penalty. And they do accept, loss of wages or a sale of a property is even a reason why you can appeal that decision.
Okay, that's good to know. Well, let's move into coverage. What does Medicare cover?
Yep. So Medicare Part A helps cover costs that are associated with inpatient care. So when you're confined to a hospital or a skilled nursing facility, and then Medicare Part B covers the outpatient services such as your doctor's office visits, your labs, your x-rays, physical therapy, MRIs, scans, things like that.
And what does it not cover? Yeah.
What does it not cover? Yeah, so this is a good one. So Medicare does not cover things like your outpatient prescription medications, which is covered under your Medicare Part D prescription plan. But it does cover inpatient prescription medications. So if you are an inpatient, in the hospital, it will help cover your medications there. It doesn't cover dental, vision, or hearing needs. However, there are insurance products that you can purchase to help cover those services. It doesn't cover foreign travel emergencies. Again, travel medical insurance is available. And then cosmetic procedures and treatments are also not covered. And to me, a lot of these are typical services that aren't covered under health insurance today outside of Medicare. And then lastly is long-term care. This is a big misconception, is a lot of people think their long-term care will be covered under Medicare, meaning when you require custodial care, help with the daily acts of living, like bathing or toileting, Medicare stops covering you when you go into that stage of life. It only helps cover rehabilitation.
Yeah, in my experience, that's also been the biggest misconception, is the difference between what Medicare and Medicaid cover.
Right.
How does private insurance work with Medicare?
Sure. So there's private insurance such as the Medicare supplement plans and then Part D plans. And you could even consider, I didn't put it on this slide, but employer insurance could be private insurance with Medicare. I don't typically recommend that you have employer insurance and Medicare, but there are some people that do enroll in both because they think they need to, but you don't need to. But your Medicare would always be your primary insurance. And then, so this scenario here, your Medicare would be your primary insurance, and then a Medicare supplement, which is a private insurance company as well, would help pay the deductibles and co-payments that Medicare doesn't cover. So it would act as your secondary. It doesn't offer services that aren't covered by Medicare. It only helps pay those deductibles and co-payments. And then lastly, you would have a separate plan for your prescription drug plans, which would help you pay for the cost of your medications.
Okay. And then how does the medical supplement insurance work? I guess you just specifically explained that, but why is it important, I guess, is the further the question.
Sure. Sorry, let me go back. So Medicare supplement, I think, is very important. I believe that it gives people a peace of mind of knowing that, when in the time comes, you're covered. You have the coverage that you need. Now, Medicare is going to cover you for the services that you need, but they have some pretty high deductibles and co-payments for certain things that they have no maximum on their on Medicare A and B. So if you had Medicare all by itself, there's like no annual maximum on it. So you would just keep paying 20% or keep paying deductibles. For instance, one deductible that I think is fairly large is the Medicare Part A deductible, which is for hospitalization. I believe it's around $1,400 right now. And that deductible actually starts over every 60 days of entering the hospital. But if you have a Medicare supplement plan, that plan would cover that deductible for you. And so to me, the Medicare supplements give you peace of mind of knowing when something happens, those copays and those deductibles are covered, where like when you're on your employer coverage, you're responsible for those deductibles and copayments. And the Medicare supplement plan insurance is inexpensive. I think it's fairly reasonable, and to have that peace of mind, I think is really important. And this just shows all of the plans that are available with the Medicare supplements. Plan G right now is the most popular one, which doesn't cover the Part B deductible, but again, that Part B deductible this year is just $226. And then once someone meant it on Plan G, then they would be covered 100%. So it's really great coverage.
Do these plans change?
The Medicare supplement plans don't change. They do update their plans every year when the deductibles change with Medicare, but the plans don't typically change.
Okay. So how, with this said, you're talking about deductibles, you're talking about, the reset for Part A for the hospital stays. How much can one expect to spend in retirement on healthcare costs on average?
Sure. So on average, like a Medicare supplement, Medicare right now is $164.90. A Medicare supplement plan, I put $200 just so you could expect increases. Right now, I'm selling premiums for 65-year-olds between $125 and $150. And then a prescription drug plan average, I would say, is about $30 to $40. So total about $400 monthly. And so then annually, you're looking at about $6,500 a year. That's if you want to do dental and vision as well.
So I would say in my, as a financial advisor, we're constantly reviewing clients' out-of-pocket costs for healthcare. It becomes part of their, projected expenses in retirement. And we on average see that over, a 30-year expected retirement lifetime, a couple can expect to spend over $300,000. So
right.
it does add up.
Yeah. Yeah. And the one thing that you're really good at is making sure that what you're budgeting for is for rate increases as well, because the premiums do go up, unfortunately, every year. Now, we do have the opportunities where we can rewrite and save people money, but, not everybody can rewrite, so because they have to answer medical questions typically.
Exactly. So when should one begin planning for Medicare and that purchase of that supplemental policy?
Sure. So typically I tell people to call me right away as soon as you're ready to sign up for Medicare, whether that's 6 months or a year. But to actually start working on it is only about 3 to 4 months before you retire or before you turn 65. But I do tell people just because it's very overwhelming, the amount of mail that people get and the amount of advertisements and phone calls. And so that's why I try to tell people to just reach out to us right away. That way we can start helping answer your questions and hopefully help calm down the overwhelming amount of advertisements and mail that you're getting. That way we can help answer all the questions.
Perfect. And then you've had a lot of experience. You've been doing this a long time. What is the biggest misconception you get from clients with regards to Medicare and the supplemental policies?
Yep. Sure. I just mentioned one earlier about the long-term care health insurance or the long-term care insurance. That's not on here, but these are the 4 most common ones. The first one is that Medicare covers all of your medical expenses 100%. A lot of people don't realize that there's deductibles and co-payments with Medicare. They just think that when they go on Medicare, everything's covered, and then they don't need anything else. And the second one is that Medicare is free. This is probably one of the biggest misconceptions is people think, oh, I've paid for it my whole life, it should be free. While I don't disagree with that, Medicare does have a premium and you do have to pay for it. Now, there are low income subsidies is what they call them that help pay the Medicare premium, but the income is so low, it's like $10,000 or $11,000 a year. It's really sad for people to be eligible for free Medicare. And then another one is Medicare and Medicaid are the same. People get those 2 words mixed up a lot. You can have both at the same time. However, they are 2 totally different programs. Medicare is a federal program where Medicaid is a state-based program. Medicaid is for income-related individuals, where Medicare is for people with disabilities and over the age of 65. And then lastly is I can enroll at any time. People think that they can just enroll whenever they want. I've had so many scenarios where people just say, well, I didn't need Medicare, I'm healthy. And they call me like 10 months after they've turned 65, and that's when they have to use that general enrollment period, and now they have a penalty, and then they can't enroll until July 1st. So those, I would say those are the four most common ones that I get from clients. And the long-term care, I would say that's probably one of the biggest ones. I should add that.
Yeah, that's true. I definitely think the long-term care is the biggest misconception that I've come across. So
It is.
yeah. So, well, with all that said, is there anything else you'd like to add about, you know, I mean, when is it
I don't
coming here soon, right?
Yeah,
I
so
mean,
right now open enrollment's getting ready to come around the corner, which is a chance for you to review your Medicare choices that you have. These are all the products that we offer here at Avery Hall, and I always try to throw in there that services are free. You don't have to pay for us to review your insurances or to help you. And the premiums are exactly the same as what you pay if you do it all by yourself. And this is my contact information. I'm here in the Salisbury office, but we do have offices in Delaware, Easton, Maryland, Salisbury, and a couple offices in Delaware as well.
great. If anybody has any questions, we'd be glad to answer any questions either via the chat, or if you want to unmute and ask the question, we'd be glad to answer them. Well, thank you, Alyssa. Definitely reach out to Alyssa if you have further questions, or me, and I can get you to Alyssa to answer those questions or explore your Medicare options. Okay.
Absolutely.
Thank you very much for
Thank
joining
you guys, and thank you, Gigi, for inviting me. It was great.
Yeah.
Thank you.